Okay, so make a motion to accept the agenda for meeting of, Scituate Board of Health, Monday, January 25th, 2021, 6 p.m. Meeting to be called, accept the agenda.
All in favor?
Okay, all in favor, say aye.
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 Okay, so before we get going to schedule items, I'd like to just go to new business and congratulate Karen Conley for being the accepting and coming aboard as our third member of the Scituate Board of Health. So it was accepted at the Board of Selectmen back in October. She's been appointed and she is up and running. I kind of just went through a little bit about the meetings and agenda. I'm wondering if Joan can send her out the calendar if she hasn't. And then I know Wendy, I had mentioned to her to send contact information. Yeah. So Karen, if you want to say anything, but welcome aboard.
Sure. Thank you. Thanks, Doug, for that introduction. And I look forward to working with all of you. Just, maybe just a little bit about myself. I am a nurse by background, similar to you, Wendy. So we have two nurses now, and spent most of my career in nursing executive practice in and around the Boston area, but currently work for a healthcare software company, really trying to improve access across the country. So I really look forward to giving back to Scituate and working with you all on the Board of Health. So thank you.
Okay, well, welcome aboard. And we'll start with the scheduled items. Discuss, vote, septic system design hearing, 16 Home Street, Morse Engineer represented homeowner, request for install of a septic system requiring local upgrades and variances.
Okay, good evening, everyone. My name is James Garfield with Morse Engineering. Let me just see if I can share screen. Hold on. All right, can everybody see that?
Yep.
Okay. So to familiarize yourself with the plan, we've got our property lines outlined here in bold. The existing single-family dwelling centered on the lot, and as you can see, it takes up majority of the lot. The site's currently serviced by a cesspool that exits out the back left corner of the building. This cesspool is failing Title V and is currently located under this deck. So we're proposing to reroute that plumbing out the front of the building, and it'll go into a 1,500-gallon septic tank and then 2 rows of infiltrator chambers. And basically all of our local upgrade requests are kind of just in reference to site constraints. This is really the only place for a system. So I guess I'll run down the requests quick. So we're asking for a reduction from 10 feet to 5 feet between the property line and the leaching field. And it looks like, so it's 5 feet on one side, 6 feet on the other. We're asking for a reduction from 10 feet to 4.2 between the foundation and the septic tank, right there. A reduction from 20 feet to 9.9 feet from the foundation to the leaching field, right there. To allow a 22% size reduction of the SAS, which is allowable for up to 25%. And then lastly, a reduction from 10 feet to 4.5 feet between the water service and the leaching field. And the water service will need to be rerouted as well. So that's pretty much it. I'll leave it to you for any questions.
Drew, was there anything on there, Drew, that we had?
No, it's as James said, it's the property is what it is. It has to go somewhere. On the water line, it is going to be sleeved. They're going to reroute it in. It's going to be sleeved. And because of the number of variances, it needs your requirement, but we have no issues with it.
Okay. Did that already go to everyone else is signed off, or is just us that we need?
I think it's just us. It doesn't need conservation or anything like that.
Okay.
I believe the conservation hearing is actually tonight. So.
Oh yeah, it says pending conservation approval.
Oh, okay.
Yeah.
Okay. Wendy, do you have any questions or?
Don't.
Okay. Do you want to?
Oh, wait a sec. One question.
Yep.
Drew, what was the it seemed like there was, when we were talking about earlier, a hole or a
Oh, no,
pit?
that's the other plan.
Okay, all right, sorry, skip.
Yep. I'm going to ask that question too, Wendy.
So do you want to do the motion, Wendy?
Oh, sorry, let me go back. Wait a minute, so,
Or do you need me to stop?
Yeah, can you slide it over? Yeah, that would be great for her, James.
Yeah.
all right. Sorry, this is like crazy. Okay, all right, so this is Central.
Home.
No, Home Street.
I mean, home, sorry, I just got to find the right one. Okay, so let's see. Okay, I move to approve the septic repair plan with the following upgrades requested. This is for 16 Holmes Road, Scituate. One, request from the required 10 feet to propose 5 feet between the property line and the soil absorption system. 2, requests from the required 10 feet to the proposed 4.2 feet between the foundation and the septic tank. 3, requests for the required 20 feet to the proposed 9.9 feet between the foundation and the soil absorption system. 4, requests from the required 10 feet to the proposed 4.5 feet between the water service and soil absorption system. And the request for 22% reduction of soil absorption system. Size reduction is allowable for up to 25%. I move to approve it.
Second? All in favor?
Aye.
Okay,
Great. Thank you.
all right.
Thank you, Jim. James.
James. All right, next. Discuss and vote septic design hearing, 232 Central Ave, Grady Consulting, representing homeowner request for installation of a septic system requiring local upgrade variances.
Good evening, I'm Darren Grady. I'm here with Peter Armstrong. Can I share my screen? Can everybody see that?
Yep.
So the project before us tonight is a septic repair at 232 Central Ave. Currently, they have 2 existing leaching pits shown here as these circles. There's 2 connections shown to the existing house. This connection's to an existing bathroom in the basement. The site is located in a velocity zone, and I do require Conservation Commission approval, which that meeting is tonight. I'm currently looking at it right now as we're doing this too. We're proposing to replace these 2 leaching pits with a 2,000-gallon septic tank and pump chamber all in one tank. The tank's H20 loading because there's a current driveway here. And it's anti-flotation because of the high groundwater. We're proposing to pump this to a pressure-dosed leaching field located right here. We are in, we cannot permit this in full compliance and need the following local upgrades. Reduction in system location setbacks from septic tank to a property line from 10 feet to 8 feet. Reduction in soil absorption system setbacks to a slab from 10 to 5 feet. Reduction in system separation to groundwater from 5 feet to 4 feet, and 1 deep hole per disposal area. If you have any questions, I'd be happy to answer them.
This was the one.
Yeah.
Drew.
What's the 1 deep hole disposal area? It's the first time I've seen that on a plan. Can you just explain it a little bit more?
Yeah, so typically you get 2 test holes, and in Title V it says you should have 2 test holes.
Okay.
Where this lot's so small and the existing system was in the middle of the driveway,
Yeah.
we couldn't do 2 test holes.
Okay, so it's a test pit.
Okay.
Exactly.
I don't have any questions.
I have no questions. Now, the
it's-
driveway is going to be in the same place, or will it be on the, are they moving the driveway, or is it staying where it is?
We're proposing to reconstruct the driveway and
Okay.
finish grades as they are.
Okay. That's all I have, and I was wondering where the deep hole was too, so. I have no further, and there's nothing else, Drew?
No, it's down in Hummerock, and it's just
What you can do.
that we do the best we can under conditions.
Okay. So if you want, Wendy, go ahead.
All right, hold on. I have to get out of the shared. Do you mind? Yep, there we go.
There you go.
Okay, I move to approve the septic repair plan for 232 Central Avenue, Scituate, with the following upgrades requested. 1, request from the required 10 feet to the proposed 8 feet between the septic tank and the property line. 2, request from the required 10 feet to the proposed 5 feet setback from the slab to the soil absorption system. 3, request from the required 5 feet to the proposed 4 feet system separation to groundwater. 4, request for 1 DEP hole per disposal area, pending Conservation Commission approval, and to, we already did this, address Board of Health questions.
So all in favor?
Aye.
Aye.
All right. I think that's it. You're all
Thank you
set.
very much.
You're welcome. All right. New business I already went to with Karen. And do we have any other new business or old business?
No, nothing else.
Okay. Other business, administrative invoices, or your director?
I do
report?
have 3 invoices that need to be signed with your permission. One is for shops disposal containers, another one is for shops disposal containers, and the third one is for a perk test.
Okay. I approve. You can sign them.
Thank you.
Do you have a director's report?
Yes, I do.
All right.
So currently, right now, obviously, everything's COVID, but with other than COVID, we do have 13 plans that are new plans that are under review right now. We have 13 that have been reviewed, and we're waiting for engineering revisions. We have 4 waiting for Concom, and then we have 21 as-built that we're waiting on various things on. To the COVID front, we have vaccinated 140 first responders here in the town. We should be getting their second dose come the first week of February. We will be giving those vaccinations out up at the EOC on the coordinating days that they got their first dose. So that's very, very good news. We are planning on doing clinics in the town. Again, we're not taking names. We're not making any plans definitively yet until we actually have vaccine in hand. But we do have plans in place for when the time comes, we will be ready. Eileen, Scotty, and Joan and Teresa in my office here, we've been getting together with all the different departments, with other volunteer groups as far as nurses, and different personnel that will allow us to distribute the vaccine. I have complete confidence that when we get it, we'll be able to do it. The big issue is going to be that individuals are going to have to go online to register. You can go on mass.gov, and they will have a web page where you can see where they are actually giving out vaccinations, and you can click on that spot and it will tell you who the clinic is for, and who can get it. Some will be restricted to whatever town it's in, but that's the way it's going to be. People are going to have to go online and register for that. We also have seen the positivity rate in the state of Massachusetts come down within the last couple of weeks. We've actually down the 7-day average right now is under 5. It's 4.82. The total number of cases that we've seen in Scituate the last week, we had, I believe, 57 from Monday to Monday. We were close to 100 the week prior to that. So we are starting to see our numbers coming down. I can't stress enough how important it is that we continue to wear our masks when we're out in public. Even if you have gotten the vaccine, your first dose and your second dose, CDC and DPH is recommending that you continue to wear your mask, wash your hands, keep your distance. So those are things that we can all do to stop the spread right now. The holiday season is over. I think that we've seen our peak where, those 10th to the 15th of January, when it's that 21-day window after the big visiting time. So hopefully we're going to be starting to come down now. I can't stress enough for people to stay home during February vacation. It's coming up soon. People make plans. We really want to try to stop the spread and just continue to do what we're doing until we get the vaccine. But we will be doing clinics. They will be announced on the town administrator will be the individual that will be announcing when the clinics are going to be done. He is our spokesperson. We want to have one message. We want to make sure it's consistent. I run everything by the town administrator every day we meet. So we just want to be consistent in our message, okay?
Yeah, can I ask you a question just about the vaccine
Sure.
distribution? Are we going to follow kind of the state guidelines about who's eligible to receive them? Or do we have different thoughts about how we're going to distribute it within Scituate?
I'm very big on following state guidelines.
Me too. I'm with you. So that's good.
I just think it's more consistent if we follow state guidelines. I hate to, how come they're doing that? And let's be consistent. I agree, Karen. I'm very big on state guidelines.
Yeah, that's great. Good.
So, Drew, has all the first responders received their first shots?
All of the first responders have received their first doses. We are looking at additional first responders that will be responding by helping us do clinics, and we're looking to get those individuals vaccinated as well.
Okay. All right.
Okay. Other than that, I have nothing else. I see we have a couple of other people that are on the call. I don't know what they're on for. If they want to have a comment, I don't know who can. You see Mr. Dottie's on. Do you have anything to say? I don't know how.
Just listening.
Okay,
Okay.
I just wanted to check. Anybody else have any comments?
Hi, this is Bob Green, 15 Elm Street, Scituate, Massachusetts. I was just curious, how do we get something on the Board of Health agenda? Do we email you? Is there a form we fill out? Is there?
Yeah, you can just email us.
Okay, well, I don't think I could find, your email on the website.
You can the Board of Health generic email, or you can email me personally, ashealy@situatema.gov.
Okay, all right. Let me get my notes together and I'll I was just wondering how it all works. That's all.
Okay.
All right.
All right. Other than that, Karen, do you have anything, or Wendy?
No,
No, I don't either.
great to get
All
an update from Drew on the vaccine distribution. That's all anybody wants to hear about right now. So.
I know.
Is there a spot, Drew, when people have questions that they should be going to online, or should they just be going to
I would
the governor's
mass.gov,
Okay.
and they have everything on there. It's an amazing page. They've updated it at least 5 times. The dashboard's been updated at least 5 times. I know, I check it every single day. So it's
So mass.gov. Okay.
yeah.
Okay.
Okay. So other than that, make a motion to adjourn the Scituate Board of Health meeting on Monday, January 25th.
Second?
All in favor?
Aye.
Aye.
All right. Have a
Thank
great
you.
night, guys.
Thank you.